special new series, Skin Savers. This morning, a cautionary tale, the story of a young woman's battle with melanoma, the deadliest form of skin cancer. Melanoma causes 80% of all skin cancer deaths, but it can be prevented. Unfortunately, many find that out too late. As a young woman, Charlie Guild was an eclectic mass of contradictions. A girl who saw Madam Butterfly 22 times but listened to hip-hop, who could love the New York Times and reality TV with equal passions.
I think that the crux of Charlie's life was to get 26 hours of living out of every 24-hour day.
Her unique brand of altruism first came out when she was just 13, volunteering first in an old age home, then in the nursery of San Quentin.
She was just a kid, and she was involved in everything, and it was always, you never quite knew what to expect.
With dreams of being a doctor one day, Charlie seemed unstoppable to those who were closest to her. But in January of 2003, this young powerhouse was suddenly doubled over with pain. The devastating diagnosis? Charlie had the most serious kind of skin cancer, advanced melanoma.
She always thought that she would beat this. I, for a long time, God knows, thought that she could beat this.
Ironically, this was not the family's first experience with melanoma. 2 years before, older sister Samantha had discovered a malignant mole on her arm.
When I was diagnosed with melanoma, to me, at the age of 27, I was healthy. I was going to be fine. It never would have occurred to me that what I was dealing with was a very serious problem.
Samantha's cancer was caught early and removed. Her family hardly talked about it again. But by the time Charlie was diagnosed, it was a very different story.
When they looked at the CAT scan, the radiologist said it was the worst CAT scan he had seen in 25 years. He couldn't believe that she was walking around, much less having gone to work that morning.
She and her friends, who were all college-educated, bright women, had no concept that this was a fatal disease. We barely had the concept.
In fact, melanoma is actually the leading cause of cancer death in women between the ages of 25 and 30, and close to 8,000 people will die of the disease this year alone.
She wanted to believe herself that she was going to beat this, so she had a very positive attitude.
But even with that spirit and her family's prayers, 9 months after she was diagnosed, Charlie passed away in her sleep. Despite her overwhelming grief, Charlie's mom immediately felt a call to action.
She was buried on Sunday, and by Friday, I was on the phone calling up high schools and colleges and talking to them about putting in a sun safety program.
Within months, she had started the Charlie Guild Melanoma Foundation, raising money for research, but also fighting for legislation to mandate sun safety education, especially for the young. It's estimated that 80% of a person's lifetime sun damage occurs before the age of 18.
I don't want to hear from one more person that their child has melanoma. I feel very strongly that I'm in it for the long haul, but I'd like that long haul not to be so long.
We thank Charlie's family for sharing their story with us. So how should you protect yourself and avoid a tragedy like Charlie Guild's? One of the nation's leading dermatologists, Dr. Doris Day, is here with some life-saving tips that we all need to know. Dr. Day, thank you very much. It's good to meet you.
Nice to meet you.
If you have any, if you think at all that you have skin cancer, the first stop is the dermatologist?
Absolutely. It's really important to see a dermatologist every year and have your skin checked, because dermatologists have the right tools to look at your skin in depth and study any moles or other spots that we think look wrong, and to take action. Melanoma can also occur in the eyes, so people who have a first-degree relative, a brother, a sister, a parent with melanoma should also have their eyes checked every year.
Really?
And it's really important to protect against sunburns. You need to use sunscreen every day. It's really important. So sunscreen, see your dermatologist every year, and know that if you have a family history of melanoma with a first-degree relative with melanoma, your risk increases dramatically, and the sun just makes that worse.
What's the most important thing we can do to protect ourselves?
One is to use sun protection. You want to use a broad spectrum sunscreen. You want to apply it inside before you go outside. Look for a broad spectrum one, like I said, one that has an SPF of 15 or higher, and one that says UVA and UVB protection.
Okay.
You want to use a new bottle. Last year's should go away because they're just not effective over time.
Does it have an expiration date on?
A lot of them do,
Okay.
and more of them
Good.
are adding. But if it doesn't, just get rid of last year's and go buy this year's, and it's good to look for one with an expiration date. And you want to use enough. I use a shot glass to give you an example. This is a 1 ounce bottle, and it takes an ounce to cover the body. And my family knows that we don't go out. Shot glasses are not used for alcohol in our house, they're used for sunscreen. And we know that we don't go out without being covered with sunscreen, and then when we get to where we're going, we reapply it.
And
so
the other,
reapplication is really
yes,
important.
Yes, the reapplication. And the other items that you have here, clothing items and such, to help protect us.
Right. Well, there's sun protective clothing. So this is light weave clothing that's actually got the sun protection built into it. And you can go from very exotic ones,
right,
or you can go to the nice and simple. And there's some beautiful examples here. And then you also want to use hats. Now, there's some good examples of hats, like one that's a baseball cap, although this doesn't cover the back of the neck or the ears, but this is nice to cover and help protect the face. This hat is a little bit problematic because it's a straw hat and it's got a light weave, and so the sun can go through. So you want to look for a tight weave if you're using a straw hat. And this is great if you're gardening. It's a sun protective hat that works well. And then there's a fabric softener you can add into your wash cycle that will help give sun protection to your clothing that way.
Wonderful, wonderful idea. I love that fabric, including it with that. Dr. Doris Day, thank you very much. I know you never get any brief about your name. No one ever,
once in a while.
It's nice to see you, Dr. Day. Thank you very much. For more